Hi, everyone. Welcome to Get Well with Dr. Shel. I am Dr. Shelena Lalji, better known as Dr. Shel, and I know as a board certified OBGYN and a functional medicine expert, your health is unique and deeply personal. It is a combination of genetics, lifestyle, and environment. Know this, no matter what your starting point is, you are never powerless over your health. Being on a health journey is a marathon, not a sprint. This podcast is about walking you through many different perspectives on health conditions, symptoms, and solutions that can help you get from fatigued to fabulous. My mission has always been to offer my patients and community the best of mental, physical, and spiritual wellness. You can learn more about me and my wellness center and schedule your telehealth appointment at drshel.com. We can support you no matter where you are in the world. This podcast is a powerful and simple way to carry the wisdom of thought leaders from around the world in your pocket and continue to develop your own healing journey every single day. So let the journey begin. Hello, everybody, and welcome to Get Well with Dr. Shel. It is my honor to introduce our speaker today, Dr. Nalini Chilkov. Dr. Chilkov is a very, very dear friend of mine. And in addition to that, she is a leading edge authority and pioneer in the field of integrative cancer care, cancer prevention, as well as immune enhancement, bringing more than 30 years of clinical experience with thousands of patients. She has a very long waiting list, and I was very blessed to have her be a very important part of my own personal cancer journey. Dr. Nalini Chilkov is the creator of the Outsmart Cancer System and the founder of IntegrativeCancerAnswers.com. This is an online resource for patients and families who are touched by cancer, and there are millions of us out there that can really use her expertise. She's also the author of the best-selling book, 32 Ways to Outsmart Cancer. This is the book right here, which I love and I use as a resource for a lot of my patients. This book is all about how to create a body where cancer cannot thrive. Her private practice is located in Santa Monica, California. Today, Dr. Chilkov will be speaking on an integrative approach to breast cancer. Welcome, Nalini. So good to have you here today with us. So, Dr. Chilkov, please tell us a little bit about this great book and about your work and your Outsmart Cancer System. You say that it is possible to create a body where cancer cannot thrive. What does that look like, and how do us women, how do we create that body that is resistant to breast cancer or to a breast cancer recurrence?
Well, what's really important always, whatever your diagnosis, but particularly with cancer, is to really have a health plan, because when you go into an oncology setting, the whole conversation's about disease and the word health doesn't even come up. So, number one, it's really important for patients and families to understand that you really need a team of good disease experts and good health experts. Also, if you have a cancer diagnosis, if you have risk, you need a plan to really transform your biosystem, transform your physiology, so that it's not a happy home, a hospitable place for cancer to develop and grow and spread. And so the sort of the basic ground of the Outsmart Cancer System is, how do you do that? How do you really choose a lifestyle that creates a body that is resistant to and not hospitable to cancer? And to remember that how we live has more impact on our health than anything in a bottle. And although that we both prescribe a lot of herbs and supplements, really the foundation of health is choosing a healthy lifestyle, healthy relationships, healthy environments. And of course, breast cancer is very influenced by the environment that we live in also, because most breast cancers are driven by hormones, primarily by estrogen, the most common breast cancers. And our environment is just full of estrogenic hormone stimulating chemicals and additives and fragrances and cosmetics. And so if you think of all the things in women's lives, all the things we get exposed to, the foods we eat, the body care products, the cosmetics, the things in our house cleaning, the things in our garden. You could take a walk through all the rooms in your house
Right.
and transform the kinds of products you have in your home and dramatically reduce your risk for yourself and your children. And remember, kids, like in littler bodies, they have an exponentially higher exposure to everything in the environment because they're just smaller. And
Yeah.
so in the same environment, they're getting a higher exposure. So when you do these things for yourself, you're doing them also for your whole family.
Absolutely. And I'm so glad that you mentioned kids because, those of us who are moms, that's something that's very near and dear to our heart to protect our family, our children. And when you look at children, their denominator is smaller, so the numerator might be the same for all of us, but their denominator is smaller. So they will be more predisposed and they will be at higher risk. And I'm so glad that you mentioned lifestyle, right? So we have to really understand, and this is something that you and I both teach and we talk about and we educate our patients on all the time. But you and I also try to practice what we preach, waking up and expressing gratitude, right? So that just gets your emotions in the right place, doing meditation, yoga, exercise, getting out in nature, taking a nice little walk, drinking our, green drinks that I have right here. It's really a lifestyle. And I'm so happy that you mentioned it. So let's maybe dive into that just a little bit. What is that anti-cancer or a body that will not let cancer thrive? What does that lifestyle look like? What do you tell your
You
patients?
have to have the basics in place. There's a lot of studies that show that having 7 to 9 hours of sleep every night are crucial for normal immune function, let
Yeah.
alone brain and your ability to deal with stress. Also, there's a lot of studies on breast cancer and exercise. Half an hour of moderate exercise 5 days a week at a minimum, of course you could do more than that, is shown to really transform outcomes in terms of survival and risk of recurrence. So not only if you're not a cancer survivor or patient, you can boost your immunity by making sure your sleep is adequate and your exercise is regular and adequate. But if you are a breast cancer survivor, you will dramatically decrease your risk of recurrence by having regular exercise and just moderate exercise. You don't have to be macho about it, but you have to move. You have to move because this is part of how we detox.
Yeah.
And so just getting a light sweat every day, far infrared saunas are fantastic. Being in a hot bath makes you sweat also. So when you sweat, you're sweating out both water and fat soluble toxins out of your system. One of the most powerful ways to just detox from our exposure to environmental toxins is to sweat every day. And so that's really, really important. And so it can be very simple. And then, of course, diet is at the ground of how our bodies build new cells. And so you change your diet, you can build a new body. And so really, when we think about cancer, when we think about breast cancer and hormone-driven cancers, then we want to take a look at where might we get hormonal exposures in our diet also. So anytime that we eat animal-derived foods, those are coming primarily from the female animal, and therefore they inherently have some estrogen in them. So you want your diet to be plant strong. You don't have to be vegan, you don't have to be vegetarian, but most of your plate should be plants. So if you look at a plate, half that plate should be plants of all kinds of colors. So we say eat the rainbow because every plant pigment is another signal to your genes. And what we want to do is turn on cancer suppressor genes and turn off cancer promoter genes. And one of the easiest ways to do that is to eat a lot of color and to eat more plants in your diet. And then you're getting more fiber. And the gut is very important in estrogen detox. So vegetarians have dramatically lower risks of cancers, particularly hormone-driven cancers, than meat eaters. And part of that is fiber, not only the plant pigments and all the colors, but fiber, because fiber will bind the estrogen so you can excrete it. But also eating a lot of plants and having a lot of fiber causes your microbiome in your gut to actually have a normal estrogen detoxification process. And if you don't have that, then your estrogen actually recycles itself back into your bloodstream, and you kind of get a double hit of your own estrogen instead of excreting it in the stool as is normal. So it's really important to eat plenty of fiber so that your body can have a normal microbiome. And then also to add some fermented foods to your diet, because taking care of our gut is part of estrogen clearance. And so having the healthy bacteria in our gut is part of that. And if you aren't sure you've had gut problems, you can do a stool analysis with a functional medicine doctor like Dr. Shel and look at whether or not the bacteria in your gut are causing estrogen to be recycled and recirculated, you get re-exposed, or whether or not you have a good ecology in there to excrete and detox your own estrogen. So you think about fermented foods, and so there's all kinds of fermented vegetables that are traditional in all kinds of different cultures. You can have yogurt or non-dairy yogurts. You can have sauerkraut or kimchi, things like that. And so these are crucial. Absolutely crucial, and having a lot of healthy fats and oils in the diet are really important as well. And then a moderate amount of protein. High protein diets are pro-cancer, and also a low carb diet. So those are the main principles: low carb, moderate protein, plenty of fats and oils that are healthy, plant strong, lots of colors, and some fermented foods. Those are the basics.
Yeah, no, that's a really, really excellent overview. And, again, the listeners know, most of the listeners know that I myself was diagnosed with breast cancer in October of 2019. And one of the first phone calls that I made was to my good friend Nalini. And, even before that, I practice functional medicine. We both do. And so the lifestyle was really an important part of what I practiced, what I preached. However, for about 3 years prior to that, we had gone through a lot of struggles with my husband having ALS. So, as most of us do this, right? We try to preach self-care and we really believe in self-care, but sometimes we're the last on our list. And that's what happened to me, because I was really focused on my husband and my family, and rightfully so. I mean, there was a lot going on we were trying to save a life. When the cancer diagnosis came, it was a reset button for me personally. It was a very important reset button for me, because I knew if I needed to be here for my family and to take care of my 2 children and my husband and everything else that we had worked so hard to create as far as our practices and our patients and our family, I needed to be well. And that is where I made sure that every principle that you're discussing, Nalini, I made sure that those principles were incorporated in my daily life, and so exercise. I mean, I went on my 4-mile walk this morning. I did some strength training. I did some yoga already. And you don't have to do an hour of everything, right? Because who has time? But like you said, at least 30 minutes of movement. And, you and I both know the studies show resistance exercise, weight-bearing exercise is very important to get your body to not be pro-cancer. I'm also very, very happy that you mentioned the diet, right? There are so many people that are just focusing on protein, protein, protein. And yes, we all need protein, but moderate protein. And if you're going to eat animal protein, please let's make sure that it's not got all these hormones in it. So try to do grass-fed beef or organic chicken without the hormones, etc. And really focus on making sure we're putting into our bodies what is going to make our bodies this amazing ecosystem that is just not going to welcome cancer anymore. And you have always been incredible to give me that motivation and that, positivity, to give me that ability to think that I am doing all the right things. And really, ultimately, isn't that what it's about? We can only do what we can do, right?
No,
And
no,
we
you
have
and I
to do the right things. We have to do the right things.
not just a long time. And it's my observation that, it's my expectation when somebody walks in my door, just the fact that they decided to walk in my door and have more of a sense of agency about what's the trajectory of their cancer journey going to be like, just by taking some control for yourself, it changes your outcome dramatically. But also, you're an example of somebody who really was all in. And it's my experience that you can't negotiate and say, well, I'll do the diet halfway, or sometimes I'll get enough sleep or exercise. You're trying to save your own life when
Yeah.
you have cancer, and your physician is focused and fascinated on your tumor, but not on anything else. And
Right.
so you have to be invested in your own health and to cause and create and sustain health for the long term, and to really have long-term thinking, because you can get kind of in a crisis physiology and just be freaked out about the next chemo treatment or the surgery that's in front of you. So you should
Right.
have support for all of that if you have to go through it.
Yeah.
And you can use integrative cancer care to protect your organs and tissues when you have toxic therapies, to have a good recovery after you go through these challenging types of treatments, to have more individualized care. We help our patients to understand how to interact with their oncologist and their oncology team to get more individualized care, to know what you can ask for, to understand that it's a flexible
Yeah.
kind of universe, and you can negotiate with your oncologist if it doesn't feel right to you, and to really help patients understand, if you have a cancer patient and the oncology setting is very disempowering and very disenfranchising to the cancer patient. So
Right.
we try to really give you your voice back and
Yeah.
say, no, you're the head of the team. We all work for you.
Right.
And, nobody can do any procedure or treatment on you without your permission. And
Correct.
so oncologists use fear to manipulate patients to do things that they don't necessarily feel are congruent. So
Right.
it's really important in any medical setting to keep your voice and to understand that you are the head of the team, and the team is in service to you as a
Correct.
patient, so that if you're not ready to start chemotherapy next week and you need a few weeks to get your life together and
Right.
get your kids together and get your business handled and be ready psychologically for what's before you, you can
Right.
say, I need more time, because cancer is not an emergency.
Right.
Cancer is not an urgent diagnosis. Cancer is a chronic illness. And by
Mhm.
the time you've been diagnosed, you've had cancer cells in your body 10 or 20 years, and it
Mhm.
just took a while for them to form a tumor.
Right.
And so it's really important not to be in that panic mode, and
Right.
really take your time, find the right care providers, make sure you have a plan, make sure you have a support system, so
Mhm.
that you can do something that is not difficult but have the best outcome. And so it's really
Right.
important to not be disempowered by
Yeah.
that oncology environment.
I'm really happy that you mentioned that. I think that you make some very, very good points. Just speaking from personal experience again, I created a team, right? I created who I thought was the best team for me. I went and sought out one of the best oncologists at MD Anderson, somebody who I could really relate to, who listened to me and who listened to my ideas and my thoughts and what I thought I wanted to do for my body. Whereas, I wanted to combine both traditional and more of the natural integrative treatments for cancer. I wanted to do a combination approach. So yes, I did go undergo surgery. I did undergo 4 rounds of chemo. I did undergo 20 some, rounds of radiation. I did all of the things that I thought was best for me, but I made very educated decisions. You remember, you and I spoke about this at length. Should I do these particular treatments? What is it going to do to my body? How am I going to protect my body and my healthy cells with while I'm undergoing these toxic treatments? Because they are toxic treatments. Now, they might be essential for your cancer. And if that's what you feel, then you should do it. But do it with your eyes wide open. You do it because you feel like this is the best route for you. And this is exactly what Dr. Chilkov is saying. You've got to just take a step back and not get into that hamster wheel. And that was very, very essential for me. And that's where, just having a past practice of functional medicine and having you at my side and really having my, practice of meditation and getting silent and really listening to my inner voice was extremely important, because I was then able to go in with a positive outlook, not a panic outlook. And I think that made all the difference in the world. And I handled the chemo and the radiation far better than I thought I would. Now, of course, I do want to give credit to all of the programs you gave to me with all of the supplements, et cetera, which is what I try to do for my patients now is, give them the protective supplements to get them through this time and stay healthy during this time. So I think that's really important. And I believe that there is place for integrative and traditional cancer therapies. I mean, we have to work together, right? Our
Well,
goal as practitioners is to do what's best for the patient. So please comment on that because a lot of patients feel like either they're going to go the natural route or the traditional route. And you and I really believe in the integrative route.
so a lot of people come into my office and say, I only want to do it naturally. I don't want to do anything else. I don't want any toxic therapies. Well, let me say this. Cancer is a formidable foe, and you only want to go through it one time. So you actually want a plan that will work. And so you have to really evaluate what kind of tumor cells you have, how advanced is your cancer, is it a treatable cancer, which estrogen-driven breast cancers are completely treatable. One of my colleagues here is a very famous breast surgeon. She was Angelina Jolie's surgeon, Dr. Christy Funk. And what she says to all her patients is, well, if you get diagnosed with estrogen-driven breast cancer, you should just expect to live. And so you have to understand that if you have a very treatable cancer, then use the tools that are certain and don't mess around. So my experience, I've been in practice 35 years. My experience is that just doing conventional oncology is not sufficient, and just doing natural medicine is not sufficient. That the very best outcomes come from combining the best of both worlds in the most highly individualized and thoughtful ways. And integrative cancer care and, functional medicine model requires a huge investment and engagement on the part of the patient. So we very carefully vet our patients in my clinic because I'm going to ask you to do so many hard things. And so you have to be on board for that because I can't give you motivation. You have to really want to participate. And so that's how it's successful. That doesn't mean we won't help you figure out how to do that, but it's really important to understand that what happens to you after a diagnosis is in your hands by selecting the right team and by following the advice that you're given. So, for example, let's say a young woman comes in with estrogen-driven breast cancer. She's got 2 little kids, and she says, I just want to do all natural medicine. And I say, well, do you want to be able to see your grandchildren, go to their weddings? And so what's the outcome we're looking for? We want a long, healthy life. So the question is, what are the right tools for the job? And so in your instance with the estrogen-driven cancer, the best approach was to put the tools of oncology, conventional oncology, together with the tools of natural medicine. That is what would give us the best outcome. So I talk to women about that who come in kind of rigid thinking and say, what is it? What's our real goal here? Our goal is that you live a long time and healthy. You don't come back to my office with a recurrence.
Right.
So it's really interesting because of the long time I've been in practice and you've been in practice, we learn and we grow ourselves as clinicians. And I used to also say, we're not doing any toxic therapies. But the truth is, there are not equivalents in natural medicine to some of the therapies that exist in conventional oncology. We don't have equivalents. We don't have a good alternative. And so if we really need something that's going to eradicate tumor cells, there aren't really, really powerful enough natural therapies to meet certain types of cancer cell challenges. And so we have to use those. But I also say to patients, it's finite. In the scope of a long life, let's hope you live to be, 100 years old, then a year of your life so that you never have a recurrence and to do things that are hard, do things you never thought you'd say yes to. But look what happened to you. You had surgery, you had chemo, you had radiation, and we had a plan in place for you that you were going to be able to tolerate those. You were going to be able to complete your treatment. You
Yes.
do have side effects, but we manage them. All
Yes.
of my patients have less side effects and less intense side effects and less damaging experiences from these therapies, and
Right.
good healing from surgery, able to have peace of mind while you go through it because you've taken
Absolutely.
control of it. That's very important. And so the other thing is that you learn from having cancer is it's an opportunity in your life
Yes.
for reflection and
Yes.
self-inquiry, and to really be clear what your core values are, what's most important to you, and you can let everything else fall away. It's an important gateway in life when you go through a serious diagnosis. And so you can take that as an opportunity to examine yourself, examine your relationships, examine your lifestyle, examine how the choices you're making. And
Mhm.
I have had the privilege of bearing witness to people transform themselves and say, cancer is the best thing that ever happened to me, which
Absolutely.
is
I
so
say that all the time.
paradoxical. But
I say that all the time. Cancer was God's way of giving me a huge blessing.
yeah,
And in some ways, a little bit of a wake up call
yeah,
because, just like I said, and we see this in patients all the time. Sometimes it takes an event, a major event in your life for you to self reflect because until then, we women think we're Wonder Women, right? I mean, I hate to show you this, but this is my cup right now. But it's pink for breast cancer. So, okay. But this was given to me by a very good friend of mine saying, you know what, stop being that. But we women think we're Wonder Women and we can just do everything for everyone. And we have to pause and say, if we're not well, if the oxygen mask does not go on ourselves first, how are we going to be there for our spouse and our kids and our extended families and our work and all of the people that are important to us? And so glad that you mentioned that it is a time of self reflection. It is a time that you incorporate the healthy areas of your lifestyle. I started sleeping more after I was diagnosed. As you know, before that, mine was situational. So, prior to Aya's getting diagnosed with ALS, I was sleeping 8 hours. When he got diagnosed for 2 years, I was not sleeping, but maybe 3 or 4 hours. So we know triggers, right? Stress is a trigger, lack of sleep is a trigger, low immune system is a trigger. And I'll have you talk about some of the triggers in a bit. But we know that when we self reflect, we can institute a lot of steps into our lives of exercise and healthy eating and meditation and relaxation and self care. And that self care takes us a long way. But to your point, it can't just be an acute time period. That has to take us all the way. And like you and I talk about all the time, we look at my body frequently. We look at my cancer labs. And I want to talk to you about one other thing that I think is very important that a lot of my patients who have cancer and who are going through cancer, we talk about this. We talk about measuring your circulating tumor cells to see where your microscopic areas are in the body. Do we have those microscopic cancer cells that may then lead us down the wrong road, and are we staying on track here? And before you dive into that, just to kind of give a little example of what I've done, we both of us together, we measured my circulating tumor cells. Prior to my surgery, it was 19, which is extremely high. And then after surgery, 12. After chemo, 5. After radiation, 0. And I've had 2 more since then, and they've been 0. So, yay. Thank you for your help on all of that. But it's gotten down not just because of the conventional treatments, but because of all of the lifestyle changes, dietary changes, exercise that we've done. So if you can please tell our listeners a little bit more about 2 things. One would be monitoring their cancer as you go on, how best to do it if they want to do it. Maybe it's not essential, but if they want to do it, how best do they do it? And the value of monitoring via different labs and different circulating tumor cells.
So, first of all, I just want to thank you for giving that example of yourself, because I'm sure that will really give some confidence
Yeah.
to other people to say it's not such a bad thing to do these
Mhm.
therapies. Now, what we talk about is monitoring the cancer terrain. And what do we mean when we say the cancer terrain? We mean that we're in the same way that you would look at the soil in a garden and make sure it has all the elements so that you get really beautiful flowers and fruits from your garden and not weeds and unhealthy
Okay.
plants. We also want to understand the soil, the terrain of your body. And so if we transform that, then we not only allow you to have a better response to your treatments, but to stay well. Now, cancers are all different diseases, but
Mhm.
they can recur. And a lot of people say, I don't want to do chemotherapy, it will kill me. And I say, no, cancer will kill you. Chemotherapy won't kill you if it's
Right.
properly administered. So people have these ideas also. So today, the way you have the experience, the way that cancer therapies are administered is really very safe for the most part, and
Right.
thoughtful and individualized and dose appropriate. And so I think people really need to understand that they're not going to be signing up for terrible damage from by having chemo, that we can manage that. And so after you are done with your therapies, then we want to make sure for the long term that we actually have a body where cancer cannot thrive. And
Right.
so there are certain biomarkers or measurements we can take in the blood of things like vitamin D has to be
Mhm.
optimized,
Mhm.
inflammation has to be well managed, your zinc and copper have to be in balance, you have to have good insulin and blood sugar control, et cetera, et cetera. So there are a long list of blood tests that we do to monitor the cancer terrain and your metabolism. And I have certain specific goals for all of those tests for my patients. So an example is hemoglobin A1C is a way to see whether or not your blood sugar and insulin metabolism is healthy and normal. Breast cancer cells are exquisitely sensitive to changes in blood sugar and insulin. That's why we recommend a low carb diet so that you don't trigger insulin. If you keep insulin and blood sugar in the lowest quarter of normal, you're
Mhm.
not sending growth signals to tumor cells.
Correct.
And we assume after you've had a treatment, a series of treatments like you went through, that
Mhm.
there are remaining microscopic tumor cells and cancer stem cells. And so you're not like at zero because you've gone through treatment. But if you keep your tumor microenvironment, your cancer terrain optimized by measuring it in a regular way and adjusting your diet, your lifestyle, your supplements, and your herbs to optimize it. Another example is vitamin D for cancer survivors should be around 75.
Mhm.
And most conventional physicians will say your vitamin D is fine if it's 30 or 40. So you want to have a care provider that understands what's right for you as a cancer survivor. Your vitamin D needs to stay higher. And so the only way to determine whether or not the dose of vitamin D you're taking as a supplement is right is to measure. And so during the first 2 years after someone completes their cancer treatments, every 3 months, I measure to make sure that we are managing you properly, but also because it is most common to have a recurrence within 6 months or 2 years. If you make it to your 2 year anniversary, the risk of recurrence goes down dramatically. If you make it to your 5 year, then it's even less. And after 10 years, you're very unlikely to have a recurrence. So blood tests that can be ordered from regular clinical labs like Quest and LabCorp or your local clinical lab or what we prescribe. And then circulating tumor cells is a very new technology. And that is a way to kind of find the needle in the haystack from a sample of blood. You're looking to see if there's any circulating tumor cells, which are these microscopic cells that do remain. And so anything from 0 to 5 is considered low risk of recurrence. And so the technology is not perfect yet. And I don't have a lab that I really, really trust 100% of the time. But there's that technology. And there's another technology called measuring circulating cell-free tumor DNA. And we have better technologies for that. And so these are not routine in oncology care. So you're going to need to find integrative cancer care or a functional care clinician who has training in how to care for cancer survivors, who knows how to do this for you. And so we measure these things every 3 months for the first 2 years after you finish your treatment. And then after that, I'll spread it out to every 4 months to every 6 months long term. And that way, we're actually monitoring the microscopic. What the oncologist does is look for either tumor markers or look for something on a scan. And those are very, very late ways to identify early signs of a microscopic recurrence. And oncologists don't treat microscopic disease. So even if you have that, let's say your circulating tumor cells were up, they wouldn't do anything. You'd have to come to me to know what to do. And so what we want to do after you have had a successful treatment is to monitor you. And if we see any red flags of microscopic activity, then we can jump on that with natural medicine. You don't need all those toxic therapies if you don't have a tumor mass. If you just have a few cells that have started to show they're active, we can put a lid on that with natural medicine. But lifestyle, you have to keep up with the diet and the lifestyle long term to have control of that. And so it really is lifestyle changes are hard. And so that requires this fundamental shift in your relationship to yourself. And that's hard too. So my suggestion is don't try and do that by yourself. Have some support, have some wise guides, a nutritionist that's knowledgeable in cancer. My nutritionist in my office is a breast cancer survivor herself, and she coaches all my patients, not only what to eat, but how to cope and how to be with this process and how to hang in there and how to stick with it long term. And so it's not easy, but it's so rewarding and empowering to actually make these changes and stand up and say, I have 0 circulating tumor cells.
You feel good. You feel, to me, absolutely. To me, it's a lot of positive reinforcement for the hard work, right? I mean, it is hard work. It's not easy. It takes a lot of commitment. This is going to be my 2nd year after the diagnosis. But it feels good. It feels really good to look at those microterrain labs, my inflammatory markers, my vitamin D levels, my omega levels, all of the things that you and I look at. And I now, look at all of these things for my cancer patients who come in to see us. It's very important to look at these things to be able to guide ourselves as well as our patients that they are on the right track. And it's important to know that, because there has to be a reward at the end of, you want that reward at the end of all this hard work. And more importantly, I think it's important to just realize and accept that cancer is not just a physical journey. It is an emotional journey. It is a spiritual journey. And we have to be all in mind, body, and spirit, because it really takes all of you to go in and to be able to deal with this and have long-term health. And that's what you're looking for. You're looking for wanting to be here for your children, for your grandchildren, for, the family that you love, for the purpose that you have in life that you want to accomplish, for all the giving back that you want to do. And if you want to do that and be there, well, it does take some work. But the good thing is there's a lot of us out there who can help to go through this journey, because somebody like you've done this for 30 years. You are an expert on not just breast cancer, but really every cancer that's out there. Myself, I've been through this journey. I know how it feels. I know the initial fears and the anxiety and maybe the sadness and what have you. And for me, that went by very quickly because I had the good, right support. And I looked at that as God's way of giving me a true blessing. And now that I feel like I'm, on my journey to healing, I feel very positive about that experience. And I want everybody who's listening to not view cancer as this horrible, terrible, occurrence. Maybe look at it as some sort of a gift that you're supposed to grow from, whether it's physical growth or spiritual growth. So that's, I think, just the perception is very important and the perspective is very important. Do you find that a lot of your patients, Dr. Chilkov, that have this really great positive attitude of healing and just visualization of I will heal and that belief that they will heal, how do you feel that that impacts their actual outcome
Well,
versus being
huge.
depressed or anxious?
It's really huge because the oncologist doesn't have that picture for you.
Yeah.
The oncologist says, well, we'll, control your tumor,
Yeah.
and the oncologist isn't saying, I'm going to give you a long, healthy life. So when a patient comes into me on the first visit, I have one goal, and that is they walk out less anxious than they walk in. And so, but how does that happen? That happens by feeling like there's a plan and there's a method and there are tools and there is knowledge, and that you as the patient can actually change what happens next and take control of it. And that feeling like there's a method, there's a system, something you can engage with, something that you can do. I think that just decreases anxiety so much. And, I practice in the Los Angeles area, so I am in a multicultural city. And so different cultures meet different life situations differently. So there's a huge Latin population in Los Angeles. And when I have a Latina as a breast cancer patient, the whole family comes in. I have to put more chairs in the room because the whole family comes in. And I already know that. I already put the chairs before they come in.
Right.
So I say that because breast cancer or any cancer diagnosis happens to the family. It doesn't just happen to the patient. It happens to anybody that's close to that person is changed by that. And because the statistics are pretty daunting, right now, 1 in 3 women will be diagnosed with cancer in their lifetime. 1 in 8 women will be diagnosed with breast cancer. 1 in 2 men will be diagnosed with cancer. So we all know somebody. We all know somebody, and that's the unfortunate news, but it means people are familiar with this experience. And I always say to patients, but let's say I have a single woman who doesn't have family nearby and she doesn't have much money and she's got to keep working or whatever it is, that she doesn't have all the privileges to rest deeply and have somebody cook for her and all of that, if you let people know that you need help, and that's one of the developmental tasks of being a cancer patient, is learning how to ask for help and receiving that help and love and care, that even people you thought, you're not even close to, whole groups of coworkers, your whole church community, people will show up. Your neighbors will show up and put lunch on your doorstep in a casserole dish. So, you have to really ask for help. Integrative cancer care is not cheap, but all these lifestyle interventions, anybody can do them. Anybody can change the foods that they eat. Anybody can get enough sleep and enough exercise. Anybody can ask for help. So the other thing I just want to say is asking for help now has another angle to it. I have a lot of patients who do GoFundMe or friend fund me or coworkers fund me. You need to have a budget to invest in your herbs and supplements and your acupuncture treatments, whatever you're going to have while you're going through this. And you need it for a couple of years on a monthly basis. So I have patients that set up a checking account that gets automatic deposits from people who care about them every month. And so they have the money to buy their supplements and to keep their appointments with me and to take some time off work, whatever they need to do to get more childcare, whatever it is they need. And I just want to say, be willing to be surprised. If you let people know you need help, it will come, because we are by nature compassionate. It's not something we have to like go to a class to get. We're hardwired to care about each other, and we just live in a culture that isolates us. And so really it's an opportunity to realize there's community, and if you don't have extended family, then you need to make family out of your community, and that's transformative in and of itself. also.
So,
And there's one other thing I want to talk about, Shelena, and
yeah.
that is the cancer patient who is living with cancer as a chronic illness, because this is a category of breast cancer patients, because some women are diagnosed at very advanced stages, unlike yourself.
Right.
And therefore, the cancer is controlled but not eradicated. And this is a new trend also in cancer care, where we don't want to blast someone with so much toxic therapies that the treatment is worse than the disease. And so now the approach, which is much more like the approach in natural medicine, is to say some people have cancer as a chronic illness in the same way that they might have diabetes or high blood pressure or high cholesterol, and that it's not necessarily death sentence, it's just a chronic illness that needs to be managed. So I try to reframe that for patients, because it is likely that those women will live a very long time with cancer as a chronic illness, and may in fact die of cardiovascular disease and not their cancer, because they live so long. So it's really important also, I think, to address this population of women, because breast cancer patients can live a very long time with a controlled population of cancer cells in their body. So I think it's really important to understand that. Oncologists don't explain this very clearly. If a woman gets a recurrence or isn't cured, she feels like she's going to die. And most often that's not the case, or it's not going to happen in a few months or this year. She may eventually die of breast cancer, but maybe that's 20 years from now. And so there's a population of breast cancer patients who are living with cancer as a chronic illness that need this kind of support. They need to know how to eat, how to care for themselves, how to manage their stress, how to manage their fear, and how to be with this, so that it's not always in the front burner and running their lives, but that it's just a motivating factor to continue to care for themselves and to be monitored and watch the blood tests, get their supplements and their herbs adjusted. If more stress comes, as it will in life, then have develop better coping capacities and be better at asking for help in those moments. So I think it's really important to understand that for some people, cancer is a long-term chronic illness that is totally manageable, and that if it's only when cancer invades a vital organ that your life is threatened. If that hasn't happened, then you're just going to live with this low level of cancer cells in your body for a really long time, the way you would live with needing to manage diabetes for a long time. So I think it's really important to reframe what that is, and that we can still have control of it.
Mm-hmm. And thank you for bringing that up, because I think that gives a lot of people not just hope, but that positive outlook about their future, so that they don't view cancer always as a death sentence, especially if it's a higher, more advanced stage cancer. It's really important to have that positive outlook and the hope that you can frame it as a chronic illness, but you're managing the chronic illness with all the lifestyle measures we spoke about, all the stress management techniques that we spoke about, all the diet, the healthy eating program that we spoke about, and the supplements and the herbs. And it has to continue on a long-term basis. We can't just say, we're going to do this for 6 months and then I'm tired of doing it. I'm going to go eat whatever I want and do whatever I want. And I'm so tired of taking all these pills, so I'm not going to take it anymore. And I think that is the toughest part, even as being a survivor and a thriver from breast cancer, is I have to get up and remind myself every single day that this is a journey and this is a process and this is a lifestyle for me. And if I value my future and wanting to be here for my kids and my future grandkids, then this is something that I want to do, not that I have to do. And I want to share a small little experience that I think is really important, because there are days after you have taken these handful of supplements that, Nalini, you have me on, but I love that we're doing this to my, with my microterrain, because I see the results. But when I look at my supplements, I tell myself, oh, I am so happy about taking these, rather than cussing these supplements in my hand because I don't want to take them. And that makes all the difference, because we all believe in, and we've all heard of this. When you're going to drink water, even, you want to, say loving things to the water because it's going to go into your body and heal you. Similarly, if, a doctor like Dr. Chilkov or myself or any of your other functional medicine doctors have given you a protocol of very important and very, difference making supplements, look at those as something that's just beautiful. And you're so fortunate to have that guidance and have those supplements, and they need to go into your body and do these wonderful things to your body. And
Well, we have to reframe our relationship to pills also, because in conventional medicine, we want to take the smallest number of pills for the shortest amount of time because there's a lot of side effects.
Yeah.
The herbs and supplements that I recommend for long term are really like concentrated food.
Yes.
And so they're only going to feed your cells and build this body. You're actually going to build a new body and a new immune system, a new tissue, and a new brain, and new bones. So you have to realize every time you take these, that's what's going to happen. And then some of my patients say, well, how many pills? I say, don't count them.
Don't count them, just take them.
Because what you understand, and I understand, but patients, let's say it's calcium or magnesium, that's a giant molecule. You can't shrink it into a little tiny pill and get enough a whole day's dose. That's just a certain amount of mass that is enough calcium and magnesium. It's not a teeny pill because of the size of the molecule. So I also think about all the tonic and nourishing herbs in this way, like concentrated food. And so if you really think about it that way, then when you're taking your supplements, you're feeding yourself. You're feeding yourself. You're building this body that is not going to be hospitable to cancer. But we even turn that around. That is going to be a body that is capable of robust health. And when you focus on health, then all these supplements are also preventing you from developing cardiovascular disease and dementia and osteoporosis and arthritis and the causes of health touch all of these things. And so once you've shifted the conversation, you're done with your treatment and you've shifted the conversation from disease to health, then you're in a whole nother universe that isn't about disease. And so then you have to be interested in health. Now, there are people like you and I who have been interested in health for decades, but there are patients who come in with a diagnosis who've never been interested in health. So this is developmental. And so I use that word because what it takes to build a new body or build a new relationship to oneself so that you make healthy choices, takes time. It goes in the rhythm of nature. And so we're a culture that wants a quick result and a quick fix, but this is not about that. This is about the rhythm of nature. How long does it take to change the physiology and the cells in your brain or your bones? It could take 6 or 12 months to build a new skeleton or a new brain. So
overnight.
It's about feeding the right building blocks to get this kind of a body. And so, I'm 68 years old and I have lived this lifestyle since I was a teenager, and I got really interested in cancer because both of my parents were diagnosed in their 50s, and neither of them died of cancer. So this is an example. My mom died at 88. My dad died at 90 of cardiovascular disease. And so they're examples of people that had cancer rather young in life, but never really had cancer be life-threatening to them.
Right.
And so I got really interested because I thought, oh my God, both my parents got cancer. I'm high risk. And so I got interested in how do you transform what your genetic vulnerabilities are. And so that's sort of what we call epigenetics, right? What are the things that change how our genes behave? And so these things are diet, lifestyle, attitude, stress management, spiritual energy. These are the things that literally change gene expression. So if you understand that that is actually what you're doing when you take your herbs, you're actually changing which genes are turned on and off. So So, let's think about some practical things that people can actually do. So, for example, what are a couple of the superfoods for estrogen-driven cancer? So, everything in the cabbage and broccoli family has a plant chemical in it called sulforaphanes, and these actually change estrogen metabolism and detoxification. Broccoli, cabbage, broccoli sprouts, kale, radishes, arugula, all of the cauliflower, all of these, you can choose something from that family of foods every day. The garlic and onion family is full of high sulfur phytochemicals, and these are very important in detoxification and estrogen excretion. And so you can have something with garlic or onions or leeks or scallions in it every single day as part of your food. You can add turmeric to your spice shelf and cook with turmeric and with ginger every day, which are anti-inflammatory, anti-tumor plant chemicals, and make your kitchen your pharmacy. These are all really important. We talked about fiber. I always get a lot of questions about soy and breast cancer. So let's just touch on that for a moment. So soy is a plant that's one of the great food plants of the world. It is the staple of most Asian East Asian diets. Right. And so China is the big lab for that. And there was a book written called the China Experiment about people who eat high soy diets, and are they more or less at risk for hormonal driven cancers. And throughout China and Southeast Asia, where soy is a core of the diet, the risk of both prostate cancer, which can be estrogen driven, and breast and uterine cancers is lower than it is in the West, where we eat a very high estrogen diet from animal sources. And so that's the big lab. But furthermore, what we know is that soy has a phytochemical in it called genistein. And genistein falls into a category called aromatase inhibitors. And aromatase is an enzyme in your tissue that will cause more estrogen to be present in your tissue. And so in conventional oncology, there are drugs that are aromatase inhibitors that are given to women to stop this process, so that if there are any estrogen sensitive breast cancer cells left in their body, they don't get this growth signal from estrogen. So there are natural aromatase inhibitors. So you can add non-GMO soy to your diet. You can take genistein as a supplement. You can also use something called chrysin, which is a flavonoid that's present in a lot of foods that alters estrogen development and metabolism. Resveratrol is a phytochemical that is also an aromatase inhibitor. It's also anti-inflammatory. And so it's very important to understand that you can select things every single day from your spice rack and from your refrigerator and from the farmer's market that actually changes estrogen metabolism also. So these are some foods: the onion garlic family, the cabbage broccoli family, and also resveratrol is present in really deep purple and deep red berries, mostly in grapes, and cranberries are common in our diet. Dark red grapes, dark purple grapes, and cranberries have some resveratrol in them. You can take resveratrol as a supplement, and this is usually part of a breast cancer plan for my patients. Eating a plant strong diet, so you're getting less animal estrogen from your food, right? Remember, the female animal, you eat her flesh, you eat her milk, her butter, you're getting estrogen in your food. So you want to make other choices that will not be so full of estrogen if you have an estrogen driven cancer. And I just want to say, prostate cancer can be driven by estrogen. So this applies to men.
Both men and women. Yes. Talk a little bit about, before we end, and I love your passion. I think you and I could probably talk for another
yes.
about all of these things that we love to talk about and we have in common. But before we close up, two things. Number one, if you could pick, and again, it is best, and we say this and we believe this, it is best for patients who are undergoing, have been diagnosed with breast cancer, undergoing treatments, or really any cancer, to seek the help of somebody like yourself or a functional medicine doctor if they want to just get started with, say, 5 supplements. What would be your top 5 supplements that you would say for breast cancer patients that are the best that you would say?
So, what you need to have foundation nutrition, and
Yeah.
then you have some things that target this particular challenge. So, you want to pick a multivitamin that's free of copper, free of
Right.
iron, and free of boron if you have an estrogen-driven cancer. And so there are supplements like that available, good multis like that. You want to have some omega-3 fatty acids, so that's your EPA, DHA fish oils. Brand matters. You want to be sure you pick a professional brand that is vetted and not full of contaminants and has proper manufacturing practices, and what's on the label is actually in the bottle. You want to be careful when you choose that. You want to have vitamin D. I'd start out, if you don't have clinical supervision by a professional care provider, start with 2,000 milligrams and then go get your blood tested and see where your blood's at. And then you go up to 5 or 10,000 a day, depending what your vitamin D turnover is in your body. Probiotics or fermented foods in the diet, so you're getting some healthy bacteria. You want to make sure you have some bone minerals and plenty of magnesium. So look for bone mineral formulas that are designed for women.
Yeah.
It's very important. But make sure that they are free of copper. A lot of bone formulas have copper in them. We restrict copper in cancer because the ability of cancer cells to spread and metastasize is dependent upon copper. So we want copper-free supplements. So there are bone mineral formulas that are copper-free. So you want to look for that. And then I always put in some Chinese mushrooms because they are so powerful as immune modulators and in managing inflammation and keeping blood sugar and insulin stable. So there's the plant chemicals and plant medicine and foods are multitaskers. And then I usually put in some curcumin, and that's not turmeric. Curcumin is a supplement. Okay, so you can cook with turmeric, but you're not going to get a therapeutic dose of it. And so put in some curcumin and about 2,000 milligrams a day. And so if you just do those few things, follow the dietary guidelines, then that's a very powerful way to begin to change your body. And then, of course, my book, the subtitle of my book, 32 Ways to Create a Body Where Cancer Cannot Thrive. So there's lots more steps you can take in there that are just doable without a doctor. And so you can go through all of that. You could also go to, I have a website where there's lots of free information for patients and families. That's integrativecanceranswers.com. integrativecanceranswers.com. And we actually have a special gift for everyone. And the link to that is integrativecanceranswers.com/Dr. Shel. So DRSHEL, integrativecanceranswers.com/Dr. Shel. And you'll get this handout that is about how to choose foods and supplements that'll transform your gut to be able to detox your estrogen. And so we don't have time to go into depth of that, but if you go to that link and click on it, it will be delivered to your inbox, and then you'll have a whole bunch of other steps you can start to take, and actually a checklist of things and a list of foods and some supplements that you can get started on also.
Well, this has been incredible, Nalini. Thank you so much for your time. Please do go to that link. Dr. Chilkov is giving away a wealth of information, and it's at no charge to you. So please go get that information. Try to incorporate everything that we've spoke about. At least try with baby steps. Get the lifestyle changes made. Take your time, but get them, lined out. Get the support from your family, from your friends, from your neighbors, and sleep well. Nourish your body, hydrate your body, move your body, try to get some stress management, maybe focus on some of the supplements that we discussed today. Look into your spice rack and your vegetable garden and your refrigerator to get all of those great plant-based nutrients, and try to have the right positive outlook and just the belief system that you are able to change your body. You are able to heal, and you are able to have a long, healthy life. We just have to look at all of these and try to implement this, and make sure you realize that you're worth it. You are worth putting this time, energy, and effort into it. And Nalini, with that, I can't thank you enough. I think our audience really enjoyed today's discussion. And thank you from the bottom of my heart for helping me go through this journey. You've just been an incredible support, an excellent friend, and just a sister of my soul. So really great to have you today.
Thank you, my dear.
Thank you so much for making time for today's podcast with Get Well with Dr. Shel. I know that this conversation and education can help you to create your best life possible on every level. So definitely tune in to hear the newest expert and learn the latest protocols to support your best health journey. You can learn more about me and my wellness center at drshel.com, drshel.com, and I hope that you will make time to come visit us in the Houston area to take a deep dive on self-care. My team and I are completely devoted to helping you live a better life from this moment forward. The best days of your life are ahead of you, I promise. This podcast is a powerful and simple way to carry the wisdom of thought leaders from around the world in your pocket and continue to develop your own healing journey every single day. So let the journey begin.